This training session is titled Risk Factors Related to Mental Health Issues. We will briefly define what mental health issues are. We will discuss those risk factors that can make you more susceptible to have to deal with mental health issues. We'll discuss some ways to counter those risk factors and discuss when professional help may be needed. So, what are mental health issues? Mental health issues are common. About 1 in 5 adults will have a mental health condition in any given year. Mental health issues can begin at any age, from childhood through later adult years. Mental health issues refer to a wide range of mental health conditions and disorders, and they can affect your mood, your thinking, your behavior. Some examples of mental illness include depression, anxiety, schizophrenia, eating disorders, and even addiction issues. So, when we look at risk factors, many people may have mental health concerns from time to time, and it becomes a mental health illness when ongoing signs and symptoms cause frequent stress and affect your ability to function. Many people don't realize it, but there are certain factors that can increase the likelihood that a person's mental health concern will actually develop into a mental health condition. We're going to look at 6 of the main factors that can increase a person's risk of developing a mental illness. Risk factor number 1, a genetic predisposition. Studies have shown that having a close blood relative with a mental health disorder, such as a parent or sibling, increases a person's risk of developing mental health problems. However, usually this link only increases the risk of developing the exact same mental health disorder as the blood relative has. It doesn't increase the risk of all mental health problems. For example, if a person's mother suffers from depression, then that person would also be at risk for developing the same condition. The fact is, genetics play a big part in mental health and can determine how likely a person is to develop a mental health problem. With that being said, just because a family member has a mental illness, it is not inevitable that other close family members will go on to develop it as well. Even identical twins that share the same DNA don't always develop the same genetic health conditions as each other. Risk factor number 2. There's a lot going on around her, and the common factor is she's stressed out. It's been proven that not only can stress exacerbate existing mental health problems, but that it can also cause new ones to occur. Once again, with that being said, being under pressure is a normal part of life and something that the human body is made to cope with. However, when the stresses and strains of daily life become too much, that's when stress can impact a person's mental health. The 2 most common mental health problems linked to stress are anxiety and depression, which should be no surprise. However, that's not to say that stress can't cause other issues as well, because they most certainly can. Let's look at risk factor number 3, chronic disease. Doctors believe that an ongoing chronic illness such as diabetes, hypertension, arthritis, irritable bowel syndrome, These things can cause mental health problems. When you think about living with a chronic illness, it can knock a person's confidence. It can cause them to feel sadness, fear. It can cause them to be stressed and overwhelmed. And that can lead to the development of a mental health problem, like, once again, anxiety or depression. But realize there is a positive side coming up. We'll get to that. Risk factor number 4, traumatic events. Traumatic events are explained as events that put a person or a loved one's life at risk. They can be in serious harm, or it could even end up being a fatality. These kinds of events can have a long-lasting impact on a person and can lead to mental health problems such as post-traumatic stress disorder or PTSD, depression, and anxiety. Once again, they linger around, that depression and anxiety. But regardless of whether the person or the loved one was actually injured in any way, trauma can still have a long-lasting impact on the individual. That's why we encourage people that even though a crisis situation may be over, don't pretend that you're 100% okay. Talk to somebody, process it. Those things help be able to be more resilient after a traumatic event. But let's move on to risk factor number 5, drugs. Using recreational drugs or alcohol on a consistent basis can not only exacerbate existing mental health problems, but they can also cause you to develop new ones. When a person suffers from both a mental health problem and drug and alcohol abuse, it's known as co-occurring disorders. And it can be very serious, especially if it's allowed to develop over time. Should a person want to get treatment for a co-occurring disorder, that's absolutely great news, because there are various treatment options available and they are really successful. However, like with all medical treatment, it can take time to work and to be effective. And with this one, the individual has to truly be at a point where they want the help. Now let's look at risk factor number 6. Research has suggested that people who struggle to form healthy social relationships, they're more at risk of suffering from mental health problems. Most people function best when their need for social interaction and social connection is met. And without it being met, it can impact their mental wellness and their mental health overall in so many ways. Studies have actually shown that when a person's social needs are not met, their stress hormones go into overdrive, which could be where the link between being unable to form healthy relationships and mental health problems lie. Because remember, there's a difference between just being alone and being lonely. Learning how to be alone is a healthy thing in and of itself. Allowing yourself to be lonely and isolating yourself can bring about problems, because that's an unhealthy way to exist for long periods of time. You've got to have some social connection. We're not meant to be islands unto ourselves. We're humans. We have to connect. Now let's look at some ways to reduce or counteract those risk factors. So, if you look at this, be physically active, follow a healthy diet, and enjoy social activity. Pretty simple, but let's give a little bit more detail. Green therapy is a real thing. Going outside can really improve your overall mental health, even for people like myself who are not outdoors people. I enjoy the inside Conditioned air is my friend. However, there's something about when I exercise, I prefer to be outside walking a trail than on a treadmill. Weather conditions being what they need to be, of course. Numerous studies have pointed to the health benefits of spending time outdoors. Even when I do my gardening, and I have raised gardens because, once again, I'm not an outdoor person, but it's something about that exercise of being outside, tending to those veggies that is really good for my mental health. Connect with those who care for you. Face-to-face interaction with friends and family calms our nervous system and reduces stress. Not all family, not all friends. Note the ones who care for you. Embrace yourself. Being true to yourself boosts your self-esteem. And having good self-esteem is vital when coping with life's challenges. If you need to change parts of yourself, you got to do it. But don't beat yourself up because of it. Something else that's great is eating well. Food can affect your mental health. To keep your brain healthy and working properly, it needs the right nutrients. A balanced diet does your mental health good. When you're in a down mood, you may crave the most unhealthy foods possible. Try not to give in to those cravings and check the box of something more nutritious and healthy. Exercise. When you exercise, your body releases stress relieving and mood enhancing endorphins. These endorphins also combat depression, stress, and anxiety. Talk to yourself in a positive manner. Positive self-talk is one of the best ways to crowd out negative self-talk. You gotta counter it. Positive self-talk shapes our thinking just as much as negative self-talk does. Remember, you may have to do 5 to 10 times more positive self-talk to counteract and eliminate the negative. But if you stay the course, the positivity will overtake the negativity. Now, with all that being said, when should you seek help? If you've tried to improve your mental health without success, then you may want to seek professional help. The objective is that you can get an assessment from a mental health professional, and they can help give you a roadmap to a greater mental health overall. Some things to be mindful of: uncontrollable or negativity and fear, concentration problems, you can't focus. You find yourself ruminating over things at bedtime or at the start of your day, things you can't let go of. Feeling hopeless most of the time. Coping by using nicotine, food, drugs, or alcohol. If you're dealing with suicidal thoughts, whether you have the intention or not, you want to be able to address those suicidal thoughts and know how to negate them and overcome them. If you're dealing with the inability to sleep, that is a big sign that you may need help. If melatonin can't help you get to sleep and you're thinking about using something stronger, I would encourage you to first have a counseling talk therapy session and see if you can get some skills, relaxation things, mind clearing to help you be able to get to sleep naturally before you decide to take a pill. Because our bodies are built to rest. And when we're not able to rest, that's typically a sign that something is wrong. If you have ruled out all medical health issues, physical health problems, then try some talk therapy before you choose to take that pill. Nothing against the pill, but you want to exhaust all other options first. In closing, Concern EAP is your employee assistance program. Please access the benefit using telehealth, video sessions, or phone sessions right now. It's available for you and anyone in your household. Know that you can go to, and email us. You can also go to our website. You can do paperwork on the website now. There are fillable documentations there. So access those benefits. It's available, and there's no need for you to needlessly suffer if the help is there at no cost to you. Our number is 901-458-4000. Once again, thank you for tuning in to this Concern Talk. And if you would like, you can put your company's name in the chat box so we can know who has attended. Thank you. Have a great day.